Good morning to everyone. See, we have seen the different approaches of controlled drug delivery system, different mechanisms. So that is dissolution, diffusion, ion exchange, resin system, right? So today we'll study about the encapsulation, dissolution, controlled drug delivery system. Okay. So what is dissolution? So dissolution, we know that when the solid particles converted to a liquid form, okay, so that is called as dissolution, right? Solid substances solubilizes in a given solvent, so whereby it will be transferring from solid to liquid, right? Mass transfer from solid to liquid, it is called as dissolution. Rate determining step here, dissolution from solid to liquid. Okay, see, rate determining step or rate limiting step means what? So which process is showing very slow rate of releasing drug. So that is called as rate determining step. Okay, see, for example, when we are administrating a tablet, different process will be going on. Once we will administrate that, right? So dissolution or else diffusion, after that metabolism, after that excretion. Okay, so overall this process, which step is taking more time to release the drug? Okay, so that step we are considering as a rate limiting step or rate determining step. Why? Because in that step only we can get to know that how much of a drug will be releasing at particular time by taking the concentration at different time interval. Okay, so that's why here dissolution from solid to liquid is called as rate determining step. So first we'll study about the encapsulation. See, encapsulation is nothing but coating of particle. Okay, see, for example, we are having the tablet, right? So in that tablet, different coating system will be there. Sugar coating, enteric coating, film coating, like different coated tablet also we can observe, right? Sugar coating tablet means the regular tablet what we're consuming, so that will be coated over the syrup. So nothing but sugar syrup, right? So enteric coated tablet means that regular tablets that will be coated over the enteric polymer. So nothing but, so one of the material is coated over the core particle, that is called as encapsulation. Okay, so here also we are coating the particle with any one of the polymer which will delay the action or which will delay the dissolution process. That's it. Okay, it is called as coating dissolution controlled system. Encapsulation involves coating of particle grains of drug with slowly dissolving material. So what it is? So it is a involves coating of particle. So powder, different type of powders of drug will be there, right? So that powder we are taking, and so different methods will be there. Micro encapsulation method, seed of grains method, seed of granulation method, conservation phase separation method. So different methods will be there for a encapsulation process. Any one of the method we are taking, so in that method we are going to encapsulate, we are going to coat this particle. Okay, so that powder form converted to granules or grains, then that grains or granules we are compressed into as a tablet, or that we are going to fill in a capsule. That's it. Okay, particles obtained after coating can be compressed into a tablet or placed in a capsules. Dissolution rate of coat depends upon aqueous solubility of polymer, stability and thickness of coating. Okay, so dissolution rate, at how much of concentration of drug will be dissolving at particular time, so that we are going to check, depends upon these three factors. That is, one is aqueous solubility of polymer. So for example, pg we are taking, polyglycols if we are taking, or pg we are taking means, so how much of aqueous solubility it is having, it is highly soluble or poorly soluble, so we have to check it. Okay, depends upon that aqueous solubility of polymer, the dissolution rate will be considering, and stability, at which pH it will be having more stability, it in which fluid it is having more stability, so we have to check it. And also with the thickness of coating, how much concentration of polymer we are added over the particle. Okay, so one layer will be there, two layer will be there, or how much concentration of polymer we are added over that core material. So depends upon these three factor, dissolution rate will be depends. Okay, so next, and also it masks the color, odor, taste, and minimizing GI irritation. This is the advantages of dissolution encapsulation system. Okay, so see, encapsulation is nothing but we are coating core material with any one of the coating material. That's it. Okay, so drug particles will be there and polymers will be there. So that polymers is having very poor solubility. Okay, and we are taking that type of polymer and we are making a solution of that polymer. For example, PEG, polyethylene glycol, we are making a solution of polyethylene glycol and we are having a paracetamol powder. Okay, then that paracetamol powder we are making as a granules. Okay, very small tiny granules, and that granules we are dipping into this polymer solution. Okay, so what happens, it will be coated over the polyethylene glycol solution, right? So then the drug will be there, which is act as a core material and also coating material of polymer also there, and that is called as encapsulated granules. Okay, so once we are doing all this process, means we are collecting different granules which is already coated with the PEG, and we are going for the compression. So how we are compressing regular tablet, or that granules directly we are filling in a hard gelatin capsule. That's it. Okay, so nothing else. And the factors, you have to remember three factors. Okay, and also advantages. That's it. Sorry. The drug particles are coated or encapsulated by using micro encapsulation method. Okay, so I said different methods will be there. So this micro encapsulation method, certain chapter will be there in your syllabus. We'll study later. Slowly dissolving material like PGs, polymethacrylates, waxes are used for coating. So these are all having very poor solubility in aqueous medium. So that's why we are taking these polymers to coat over the drug particle. That's it. Okay. So in this diagram you can observe. So here one coated layer will be there, right? So inside this drug particle will be there. Okay. So this drug particle is these drug particles will be coated over the one of the rate controlled surface. Okay, so that is called as coated membrane, and this is whole thing, it is called as drug reservoir. Drug reservoir is nothing but the drug particle is reservoired in one of the system, so that is called as encapsulation system. That's why we will call it as a drug reservoir. Okay, and in this picture we can observe, so here the drug particle is embedded in a polymer layer, so at time 0. Okay, so while before it will be going to a dissolution process, so everything will be reservoired in a polymer coated layer. Okay, so once all the fluid it will start to reach this tablet or this capsule, means what happens, it will absorb the dissolution fluid, and whatever the polymer layer will be there, and it will start to solubilize slowly. Okay, so once the solubilization is occurred, means whatever the drug will be there inside this coated material, it will start to release out of the polymer layer. That's it. Okay, I hope you understood. Okay, so this is about the encapsulation system. Say for example, very poor soluble drug will be there. For example, griseofulvin. Okay, so that is one type of drug which is having very poor solubility in a aqueous system. Okay, so in that condition we no need to coat any type of polymers. Drug itself act as a sustained action. Okay, so it will act as a natural sustained drug release system, griseofulvin. Okay, because it is having very poor solubility in a aqueous system. But when it will be, we are having a pentoxifylline. Okay, so that drug, it is having very high solubility and very high aqueous permeability also. Okay, in that condition what we have to do, either we have to coat with the polymers with a high concentration, okay, or else we have to convert that pentoxyfill into different polymers which is having very poor solubility. Okay, so like that we have to convert the rate of drug release from higher to lower. So nothing but just we want to delay the action of drug release, okay, for a longer time. So controlled drug delivery system itself, it says that it is a controlled action, prolonged release of drug, right? For this and action, for these actions we have to delay the rate of drug delivery by adopting any one of this system, encapsulation or matrix system. That's it. Thank you.